Hello, I'm Andrew Renwick, Consultant General and Colorectal Surgeon here at Ross Hall Hospital in Glasgow. Today I'll be answering some of your most asked questions about having a colonoscopy. If you're struggling with unusual bowel symptoms, you'll want to know what to expect from this common diagnostic examination, which is often used as a screening test for bowel cancer. Don't worry, I'm here to help you with a wealth of expert information and advice, so let's begin. First things first, what is a colonoscopy? Simply put, it's a test to check inside your bowels and understand the cause of unusual bowel symptoms such as blood in your stool, abnormal bowel habits, and even stomach pain and cramping. So, what happens during a colonoscopy? During the exam, your consultant will insert a thin, flexible tube with a small camera at the end of it. This goes up and into your bottom. This tube is called a colonoscope, or sometimes just a scope. The device is connected to a large screen that shows real-time footage of the inside of your bowel, so your consultant can look inside and see clearly. You might feel the scope go inside you, but it shouldn't be painful. Your consultant will move the scope around to have a thorough look inside your bowels and get an understanding of why you might be having unusual symptoms. If they find any growths, which can also be known as polyps, they will remove these with a small, tiny wire loop. This is passed through the colonoscope. Bowel polyps are very common and usually harmless, but can sometimes lead to bowel cancer if left untreated for a number of years, which is why it's very important to get them removed during a colonoscopy. Why might you need a colonoscopy? We usually want to look inside your bowel if you have symptoms such as blood in your poo, bleeding from your bottom when you go to the toilet, unexplained weight loss and diarrhea, or changes to your bowel habit. We look for a variety of causes of these symptoms, including Crohn's disease, ulcerative colitis, or bowel cancer. You might also have to have a colonoscopy to specifically check for bowel growths, which are mostly non-cancerous. You are more likely to have a colonoscopy to specifically screen for bowel growths if you have a history of bowel polyps or cancer in your family or are over the age of 50. As I mentioned before, they can become cancerous if left untreated, which is why you need to have them removed during a colonoscopy. Bowel polyps don't always have symptoms, but they can sometimes cause similar symptoms to other bowel conditions, such as blood in your stool and an overall change in your bowel habits. Are you sedated during the exam? Yes, you will be offered a sedative on the day of your appointment. This is to help you relax and make the procedure feel more comfortable. This sedative is given through a small tube in your arm. You might even be offered gas and air, which you can breathe in to help you relax. Having a sedative isn't the same as having a general anaesthetic. With general anaesthesia, you are unconscious and completely unaware of your surroundings. But with sedation, you feel comfortable, sleepy, and relaxed. You might even drift off into sleep at points, but this isn't the same as being unconscious. Is it painful to have a colonoscopy? No, it isn't. As I said, having a colonoscopy shouldn't be painful, especially with the use of a sedative to make you more comfortable and drowsier. You will feel the colonoscope be inserted, but this won't cause any pain. Can you eat and drink before the exam? There are certain foods and drinks to avoid in the days before having a colonoscopy, such as pulses, grains, and wholemeal bread. Your consultant will explain in detail what you can and can't eat and drink 24 hours prior to the exam. I personally recommend avoiding pulses and seeds before a colonoscopy, as they can block the colonoscope. You might also take a laxative to empty your bowels the day before, so we can have the clearest possible view of the inside of your bowels. At Ross Hall, we will provide the instructions for this ahead of the exam and make sure you take your laxatives properly. How long does the exam take? It's a relatively quick test that takes 30 to 45 minutes in total, depending on whether I need to remove any growths or take biopsies. Does it take long to recover from a colonoscopy? You can leave hospital on the same day as the colonoscopy, but we advise arranging for someone to collect you, as the sedative wears off and you feel groggy. You might also have bloating and stomach cramps for a few hours, which will pass. We also recommend taking the next day off work because you'll need to use the toilet regularly because of the effects of the laxative. It's always less anxiety-inducing to have your own space and privacy for this. Don't be alarmed if you bleed from your bottom or find blood in your stool within a few days of having the test. This is normal and nothing to worry about. You should rest and drink plenty of fluids the day after. If you have had biopsies taken or growths removed during the exam, your consultant might recommend you avoid certain foods until advised otherwise. They will make sure you have all the information you need to follow these instructions, so don't worry about feeling unprepared. This is a relatively standard test, so most people recover quickly after a colonoscopy and can return to normal everyday activities within 1 or 2 days of having the exam. So, when do you get your results? It can sometimes take up to 2 weeks to get the pathology results from the biopsies. In other cases, I can tell you the cause of your symptoms immediately after the examination. The time frame really depends on whether I find any growths or signs that need to be investigated further. I will let you know exactly when you can expect your results after the examination. What are the next steps for treatment? This depends entirely on the type of treatment you need and whether you need further treatment at all. I might not find any unusual growths during the exam. If I do remove a polyp and take a biopsy of it, which is a small sample of tissue, the next step is to wait for the pathology results. If these determine that the polyp is cancerous, we can discuss further investigations to determine your stage of cancer. This will also depend on a variety of factors, including your unique situation and circumstance. It is more common than not that a polyp is not cancerous, but as mentioned above, it's important to remove these before they develop into a cancer. If I determine that you have a separate condition that is causing your unusual bowel symptoms, such as Crohn's disease, we can discuss the next steps of your tailored treatment plan. Every person is impacted by a bowel condition differently, so it's about finding the right combination of treatment options that work for you. We can discuss this in detail, and I can arrange for you to see the best specialists, including myself here at Ross Hall. What are the common treatment options for Crohn's disease? A colonoscopy is commonly carried out to test for Crohn's disease. This is a chronic inflammatory condition that affects any part of your gastrointestinal tract, but more commonly the end of your small intestine and the beginning of your colon. Symptoms of Crohn's disease can vary widely, but often include severe abdominal pain, frequent diarrhea, weight loss, and fatigue. Many people experience symptoms in flare-ups, with long periods of no symptoms, followed by bouts of extreme pain, cramping, and difficulty eating. There's no definitive cure for Crohn's disease, but the treatment options are highly effective, allowing you to manage the condition and live a normal, active life doing the things that you love. These options include a combination of specialist steroid medication to combat inflammation and sometimes surgery to remove a small part of your digestive system. If you suspect you have Crohn's disease, a colonoscopy can determine this by looking for clusters of inflammatory cells called granulomas. These are found through taking biopsies. If you do have Crohn's disease, we'll discuss the best options for you in terms of next steps and treatment. So there you have it, a run through of what it's like to have a colonoscopy and why you might need this common diagnostic test. If you'd like to discuss having a colonoscopy in more detail, you can book an appointment with me or your nearest consultant at circlehealthgroup.co.uk. We hope you found this video useful, and don't hesitate to leave any questions in the comment section below.